Candace Owens recently made a YouTube video where she claims that therapy is ruining Western civilization.
Eyes, yes. This makes me a better person somehow.
Bold move. Wrong. But bold move, my friend. Let's talk about it. So if you've never met Candace, she makes YouTube videos. She has an audience of over 1 million people, which is very impressive. That is not in any way, shape, or form an easy thing to do, but it's also very terrifying because she really likes to give out incorrect healthcare information to her massive audience, and I'm just not here for it. And this week, her target was therapy. Like, why? Why do you have to go after one of the one nice things we have? Well, here is what Candace would like you to know about therapy.
So I said yesterday to my team that I wanted to talk about therapy, group therapy, familial therapy, couples therapy, all of it, because I have this idea that it's ruining Western civilization. I really do.
So we're off to a good start.
But there's no question that therapy has rendered not just men weaker, by the way, I would say, but women weaker as well.
Like I said, bold claims, which is honestly completely fine. Candace can believe whatever she wants about the downfall of Western civilization and what it is. We do not agree at all on what that actually is, but that's the fun thing about having opinions is we don't have to agree on said opinions. Facts, though. Facts, we should agree on those since they are really not up for interpretation. They are simply true or not true. And this is where we run into a little bit of trouble. So Candace states as fact that therapy is enabling people to use previous experiences as a scapegoat so they can do whatever they would like in life.
I feel like people are going into therapy and they're actually becoming worse people, likely because their therapist is telling them that literally everything they do is okay and can be understood, right? As long as you talk about all the bad things that you're doing and all the bad things that you're feeling, then it's all right.
Now, immediately after seeing this made me think that Candace had never been to therapy in her life or looked into it much because that is not at all what good therapy should do. In fact, I know when I was going to a therapist, they did not hold back from letting me know where I was being the worst and that I needed to try to figure out where that was coming from so I could fix it. But never was there ever a mention of like, oh, well, it's fine, you're being like this because it's all from this other event and that really messed you up. No. It was like, yeah, that sucked. Let's fix how you process all of that so you stop doing other things that also suck. Because the entire goal of therapy is not to shift blame away from your actions. It's to understand why you had the reaction, identifying what might have caused that reaction, and then trying to reframe or work through those emotions surrounding the cause so that you do not do it again. You can understand why you reacted poorly while also owning the fact that you did, in fact, react poorly. Both can exist at once, and therapy can help you realize that. So it really steamed my buns when Candace presented therapy in such a false light. And as it happens, Candace does go on to tell us that she has, in fact, had therapy. When her parents were going through a divorce, she had it and she hated it. So maybe she, I don't know, had a bad therapist or wasn't like receptive to it at that moment. Because if you're not feeling it, it's just going to be weird and uncomfy and not great. And all of those things are totally fair, by the way. Or maybe it's just like completely not for her. Also very fair. And if she had just said this, honestly, even the things that we all just mentioned, I never would have addressed this. You know, hopefully people in her audience would have realized, wow, Candace, that's kind of off the mark of what therapy is. And we all could have just moved on from it. But then,
eyes, yes.
She thinks therapy is why Prince Harry is the way he is. However, that is, because I don't really follow British royalty like at all. The only royalty that I am loyal to is Queen Mia Thermopolis of Genovia. Thank you. But for some reason, Candace is very invested in the integrity of the royal family, which Harry has now, I guess, distanced himself from. She stated in her book review that he was betraying his family by doing this and that is absolutely sickening. And Candace hates this dude.
I think Harry is the worst kind of person that this planet has to offer.
She also really hates his wife, Meghan Markle, as well.
You are both rotten to your core.
Now, Liz, you don't follow these people. How do you know this? Well, she made a whole book review roasting this book Spare that recently came out, where he talked a lot about like different mental health stuff. And to say that she didn't like that book, that would be putting it mildly.
I actually believe that it is beneath the Kardashians. I'm going to, I guess, start by giving you some alternative titles for this book. Unbearable, maybe on Unsparable, a play off of Unbearable. Unsparable, and it could just be a story about how this special privileged little snowflake wants you to sit through him whining.
If you want a follow-up analysis of her truly like off the mark and harmful viewpoints that she made in that video, do let me know. But for now, all you need to know is that the whole reason that we are here and are about to watch the clip that made me make this video was because Candace Owens has big mad feelings about this book that Harry wrote, largely about his mental health, it seems, after going to therapy. Specifically, he went to EMDR therapy.
It's Prince Harry's therapy that he's sharing with the world. He crosses his arms and taps his hand on his chest while he closes his eyes and moves them back and forth. He's instructed to visualize negative thoughts. The therapy is called EMDR, which stands for eye movement, desensitization, and reprocessing therapy.
So Harry has found EMDR therapy helpful for PTSD or post-traumatic stress disorder. Wonderful. His mom died, which is not wonderful, and I'm sure caused a lot of trauma. I'm sure there's also been a lot of other rough stuff because living life is just like rough at baseline, and then living under the scrutiny of, oh, you're a prince and everyone knows your name, on top of all that other stuff just sounds like awful. I didn't read the book to find out what else happened. Again, like, I don't care. But I think we could all agree that your mom dying is trauma, and him finding a way to heal from that in a healthy way, like going through EMDR therapy, that's good. Right? Well, let's see what Candace has to say about it.
Eyes, yes. This makes me a better person somehow.
I'm sorry, but were you just mocking someone for participating in a healthy coping mechanism like EMDR therapy? Like, what the actual hell is wrong with you? And like, that is horrifying. But what is even more baffling is that she would do this entire video making fun of him for being in therapy, because in her book reaction, she roasted Harry for using drugs when he was 17 to cope with PTSD symptoms, even when he acknowledged like they weren't fixing it. And Candace was saying things like, oh, he should have been able to like put those pieces together and figure it out and find a different way to cope. He was a child, Candace. He was 17 years old. 17-year-olds don't cope, they react, which you judged, Candace. And then he grew up and found a better way to deal, and you made fun of him for it, sending the message to your 1 million followers that therapy is a joke and you should be made fun of if you participate, and that is disgusting. So after this stunt, Candace then incorrectly describes therapy again in this video.
As we move toward this society that believes that feelings trump facts. The facts don't matter, that the feelings are so important that we have to ignore the facts. We have to assume that the majority of the therapy sessions that are happening are reflecting that.
While she does acknowledge it could be helpful for some people, again, she said it's not for most, and stresses how therapy promotes people to honor their feelings over facts, and that therapy tells you facts don't matter. But since that definition is a complete lie, and many humans who go to therapy do in fact appreciate facts, here are some facts for you. EMDR is eye movement desensitization and reprocessing therapy, defined officially as the structured therapy that encourages the patient to briefly focus on the trauma memory while simultaneously experiencing bilateral, both side, stimulation, typically eye movements, which is associated with a reduction in the vividness and emotion associated with the trauma memories. Essentially, all events in life, like that we don't process, right? Imagine them becoming little bubbles holding emotions and feelings. Now, some of these bubbles are filled with happy, fun, or calm, or grounded memories, and some are filled with fear, anger, and hurt. And the bubbles are all around us. And when life inevitably happens and something goes like a little off course, a bubble, you bump into it and it gets popped. And what's inside that bubble greatly shapes how we react to that little life bump. If we pop a bubble that had stability and happiness inside, we might be able to cope with that life difference very well. But if that bubble releases anger and sadness from a previous event, we react with anger and sadness to the event at hand, even if that reaction is completely out of place or out of magnitude for what just happened. And the hard part is you never know which bubble you're gonna pop and that will open up, which means you don't know which coping mechanism you'll have at hand to tackle life's bumps. And that's PTSD. Treatment for PTSD comes in several forms, with some of the most common being cognitive processing therapy, EMDR, prolonged exposure therapy, and SSRI or SNRI medication, or like a combination of those things. Prolonged exposure and medication are kind of self-explanatory, but I was curious about the differences between cognitive processing therapy and EMDR. So cognitive processing therapy appears to focus on altering emotions and thoughts and how you think about an event, with the goal being reframing the feelings that you have around the traumatic event. Essentially, the feelings are like ingredients and the traumatic event is the recipe, right? That you keep going back to. And when you're baking, you are making little angry rage biscuits, okay? And you don't know why all your biscuits are coming out really angry and ragey. So you go to therapy and you see if you can better understand the ingredients and learn how to work with them and view the recipe in a new way so that you can make fluffy, peaceful, happy biscuits instead, right? That's the first kind. EMDR is completely different because it focuses directly on the event or the memory and tries to change the way the memory is actually stored in your brain with the goal of reducing or eliminating the problem from being there in the first place, reframing the event, kind of like scrubbing it away, and also processing it as you clean it up. In this baking situation, right? If you're doing EMDR, you decide you are going to throw the entire stupid recipe away and get rid of most of the ingredients, kind of take what you learned from this baking experience and then just like move on with your life. I'm done with this. How does that even happen, you may ask? Honestly, it's fascinating and kind of resembles what the brain does during REM sleep when it decides what it's going to, like the memories it's going to keep from the day and what it's going to put in the trash folder. EMDR uses eye movement and rhythm tapping or auditory stimulus like beeps while focusing on traumatic memories for like 15 seconds at a time. And after you relive it, you kind of process it, see what comes up, work through that, and you keep doing that again and again until it hurts less. And it's proven to work by science and research, which is great. So despite Candace thinking that it's a funny joke, it's not. The VA, the World Health Organization, the American Psychiatric Association, the National Institute for Health Care and Health Excellence, and International Society of Traumatic Stress Studies find that EMDR is beneficial, and when provided by trained practitioners to the appropriate patient, it can be really, really helpful. So for a moment, let's just completely disregard how completely awful it is to mock someone for seeking mental health treatment, because that doesn't need an explanation, I don't think. And let's just see, since Candace thinks therapy is ruining Western society, what does she suggest then? Because it's estimated that about 1/5 to 1/4 of all adults today, and I think that number is honestly underrepresented, have mental health struggles. So what does she recommend to help with these billions of people? What should we do to get through it? She starts by stating that she hates it here. Good start. Finally, Candace and we can kind of come together on something because this has been a weird few days researching this stuff.
Well, it's produced a society of men like Prince Harry and women like Adele who overshare, who tell us way too much. And it's not a society that I want to live in.
Okay, Candace, but if you don't like it here, then where would you like to live?
I want to live in a society like the one that my grandfather lived in. And I tell people this all the time. I never saw my grandfather cry a day in his life, even when I knew he was positively destroyed and heartbroken when we lost my grandmother, surprisingly, right?
All right, friend, that's a weird flex, but if you're impressed, you do you.
He was one of those men that believed that no matter what you were going through, you let it burn in your chest.
Okay, but let's not do that, friends. That is not the way. We have so much data to show us that people who bottle in emotions are sicker and die sooner. They have an increased rate of substance use disorders, addiction, cardiovascular disease, and events like heart attack and stroke, and even cancer. The list is long of the complications of bottled up emotions that are held within your chest your whole life. And maybe this method really did work for Candace's grandpa, okay? But when you look at the data from thousands and thousands of grandpas, it didn't work for most. And unfortunately, that mentality of just like shove it in, don't talk about it, that was very much the mentality of that time, to just hold it in. And on a large scale, it has been an approach that is really harmful. And that is a fact, that is not a feeling. Other facts, while we're here, therapy is beneficial to many, many humans. Not all by any means, but many. Also a fun fact, there are so many different types of therapies and therapists. It might take a minute to find the right one for you, but know that that is normal. And if you are looking for a therapist, Psychology Today is a good website to get a start with that. It can help you find one in your area who might take your insurance or who specializes in something you're struggling with or fits a certain demographic of a person that you would like to see. You can enter all of that in there and it will spit out who it thinks a good fit might be for you. Which brings us to fact number 2, okay? Therapy is freaking expensive and poorly covered by insurance in the United States because as a society here, there is so much of a toxic narrative around therapy that therapy is for the weak and we don't value mental health like at all in this country. And I have seen the harmful effects of that on personal level and on a professional level, and reflecting on my own, I'm sure that's a huge reason why this video made me so angry. So that being said, if you ever get a chance to vote for legislation that increases access to therapy and other mental health services, please do that because it is beneficial, and that's a fact. Fact 3. Candace Owens is not a healthcare professional. Please consider who you are getting your healthcare information from on the internet and in life. I have done a whole different video on Candace where she recounts her birth experience and puts out a false and dangerous narrative about group B strep infections in infants, where, shocker, her facts in that video were straight up false, just like in this one. If you want to watch that, I'll leave it in the description below and somewhere up here. Fact 4, in the description box, you'll find some resources, some YouTube channels that talk about like therapist-y mental health stuff, some websites to support the facts in this video, and the link for Psychology Today in case you are looking to find a therapist yourself. And fact 5, you, my friends, are not alone. You are more than enough, and you can do the hard things. I hope you have a lovely rest of your day, and I will see you next time. Bye, friends.